Welcome to my YouTube channel. Today I'll be speaking very briefly about two conditions, but they are interrelated. Number one, deep vein thrombosis. In the previous video, I mentioned swelling occurring in both legs. In this video, I speak about swelling occurring in one leg. If you've observed swelling in one leg, number two, pain in your calf. If these two symptoms are present, you need to consider the possibility of what is referred to as a deep vein thrombosis. Usually blood flows in a very well-organized way in a fluid state. However, for some reasons, if there is a formation of clots within the blood, typically that could start in one leg. And if that occurs, that clot, when it occurs in a blood vessel, is referred to as a thrombus. If that thrombus dislodges from that vein, you now refer to it as an embolus. So it starts out with a clot, which is a thrombus on the vessel wall, and then dislodges as an embolus. The problem is that the blood from the lower limbs go to the heart. There is then a connection between the heart and the lungs. And so if you have a situation where this clot that has dislodged, in other words, the thrombus that has become an embolus, now moves to the heart, and then from the heart it gets to the lungs. Because of the kind of vessels, very tiny vessels, the small vessels in the lungs, that clot can be trapped in the lungs. And so the patient that starts out with a deep vein thrombosis, in other words, pain, swelling in the leg that was not addressed, later can develop a more difficult, challenging, complex problem, which is the pulmonary embolism. In pulmonary embolism, the patient becomes breathless, the patient coughs, and then produces sputum. There is chest pain. This pulmonary embolism is potentially life-threatening. It's important that we halt the process at the level of a deep vein thrombosis before it becomes complicated as pulmonary embolism. If you've learned something from this video, I expect that before you sign out, you will subscribe. Thank you and bye.